So let's talk about the adrenal glands. They consist of two regions, the inner medulla and the outer cortex. So in your adrenal medulla, the chromaffin cells and the adrenal medulla secrete two hormones, epinephrine and norepinephrine. These are classified as catecholamines and are secreted in emergency or stress situations. They do this by increasing your blood pressure, heart rate, converting glycogen to glucose in the liver. They increase your metabolic rate. They produce more energy, causing bronchodilation. They cause dilation of blood vessels, and they stimulate the cortex to secrete steroids called stress hormones. In your adrenal cortex, it secretes hormones called steroids. So steroids are lipid-soluble hormones made from cholesterol. The adrenal cortex secretes three steroids: glucocorticoid, mineralocorticoids, and sex hormones. So they regulate sugar, salt, and sex. So for your glucocorticoids, they affect carbohydrates. They convert amino acids into glucose by glucogenesis, thereby maintaining blood glucose levels between meals. So your chief glucocorticoid is cortisol, which is secreted during stress. It is thought that abdominal fat associated with heart disease is deposited in response to stress-induced chronic secretion of cortisol. Your mineralocorticoids. This is aldosterone. It is known as the salt-retaining hormone. The primary target organ is the kidney, where it acts to reabsorb sodium and water and eliminate potassium. In the absence of aldosterone, the body loses salt and water, and both blood volume and blood pressure decline. Your sex hormones. So that is estrogen and testosterone. And the sex hormones of the ovaries usually mask the effects of the adrenal sex hormones. Negative feedback again. So in the absence of ACTH, the adrenal gland becomes lazy and it stops production of cortisol. If a person suddenly discontinues a drug such as prednisone, the lazy adrenal gland no longer produces cortisol in response to ACTH, and that person may develop a lethal acute adrenal cortical insufficiency. So in your do you know box, it says that too much steroid can cause Cushing's syndrome and too little steroid can cause Addison's disease. So let's rethink. List the two catecholamines secreted by the adrenal medulla. That is epinephrine and norepinephrine. List the three groups of steroids secreted by the adrenal cortex. Cortisol, aldosterone, and sex hormones. Number 3, explain the following. A person has been taking prednisone for 1 year. She suddenly stops taking the drug and develops a life-threatening acute adrenal cortical insufficiency. So without ACTH, the adrenal gland becomes lazy. If a person suddenly discontinues prednisone, the lazy adrenal gland no longer produces cortisol in response to ACTH. Steroid drugs should never be discontinued abruptly. Dosage is tapered off so the lazy adrenal gland has time to recover and regain its ability to respond to ACTH.